Heather Einarson. I am completing a nursing head-to-toe health assessment for Presentation College. This is my patient, Ashley Matson, date of birth 7/29/86. Prior to entering the room, I did obtain a set of vitals and privacy was provided. Level of consciousness was assessed. She is alert to person, place, and time, and she's alert. Her mood is good. Her personal hygiene, she appears to be clean. Her her posture is good, and her mobility is good. She was able to walk into the room unassisted, and she has the ability to hear and speak as observed by her answering my questions. I will be looking at her skin and will be checking throughout the exam, looking at the color, pigmentation, moisture, temperature, turgor, and texture and lesions. I'm going to start by assessing her head and face, inspecting the scalp, looking at the hair and cranium for any lumps and bumps, or any abnormalities. Is there any pain or tenderness with that?
No.
Alright. Everything appears to be good. I'll have you look at me, and I'm going to assess facial expressions and symmetry. So I'm going to have you smile, frown, and puff up your cheeks, and that's all symmetrical. I'm going to palpate the maxillary and frontal sinuses. Any pain or tenderness with that?
No.
Alright. Looking at the temporal artery. That's palpated as strong bilaterally. Alright. I'm going to have you open your mouth, close it, and move your jaw side to side. Assessing for TMJ, I do not hear or feel any clicking or grinding. And next I'm going to inspect the eyes, so I will have you stand up and come right over here. We're going to do a visual exam. I'm going to have you cover your right eye for me first and read the lowest line without squinting.
EXFGS.
Okay, and if you want to take a couple blinks and go ahead.
EXFGS.
Alright, perfect. You can have a seat. So it appears that she does have 20/20 vision. Next I'm going to be looking at her eyelids, making sure that there's no redness, the skin around them is intact, there's no excessive dryness. Eyelashes are good, full and uniform throughout. They're evenly spaced. Just going to lift your eyelid up, looking at the sclera of your eye. And that does appear to be white. There's no redness or irritation that I can see. I'll look at the conjunctiva. And that looks good bilaterally. There's no drainage or anything noted. And next I'm going to be looking at the cornea and the iris. So the cornea appears to be smooth, translucent, and the iris is round and there's no discoloration. The color is uniform around. Now I'm going to be looking at the pupils. And they are equal, reactive to light and accommodation. Next, I'm going to be checking your visual field, so I'm going to give you a card, and I'm going to have you cover up your eye, and I want you to tell me when my pen comes into view for you.
Okay. Yep. Yep. And yep.
Alright, and then I'm going to have you just switch eyes.
Excuse me. Yes. Yes. Yep. And yep.
Alright. Alright, then I want you to follow my pen. Very good. And then the next thing I will be looking at is the red reflex. And that is normal. Alright. Next I'm going to be looking at your ears. Looking for any redness, inflammation, or any lesions, which appears to be good. I'm going to palpate the ears for tenderness. Any pain with that?
Nope.
Alright, and then I'm going to be palpating the lymph nodes, the pre-auricular, and then the posterior auricular, which I do not feel anything. Alright, I'm going to have you cover your right ear for me and let me know what word I'm saying.
Chair.
Okay, and the next other ear?
Baseball.
Very good. I'm going to place this on top of your head and let me know when you can no longer hear it.
Okay.
Alright, that was within normal limits. Sorry. I'm going to complete the Rhine test. So I'm going to strike this. I'm going to place it directly behind your ear. You tell me when you no longer feel it.
Okay.
Okay, now I'm going to do the same and place it in front of your ear.
Okay.
Alright, I'm going to do the same on the other side.
Okay.
Okay, one more time.
Yep.
Alright, and that was within normal limits. She heard the tone on the front of the ear 2 times the length of behind the ear, which does indicate that she does not have any conductive hearing loss. Then I'm going to look in her ears. And her eardrum is visible. It is a pearly gray, and it is translucent. There's no redness or inflammation noted. There's no pain or tenderness in there.
No.
Alright. And that looks good on that side as well. Next I'm going to be inspecting the nose, looking at the nasal structure. It does look midline. I'm going to look with the along here. The septum is intact. Sputum looks normal. And the turbinates are dark pink in color. I'm checking for the patency of the nostril. And that looks good. Next, I'm going to test your sense of smell. If you can just tell me what you
Coffee.
smell. Very good. And that is testing the cranial, or first cranial nerve. Then I will be looking in the mouth. Put your tongue down for me. Looking at the tonsils. That looks good. I'm checking the mobility of the uvula, so I'm going to press down. If you can say ah.
Ah.
Very good. And then I'm going to have you stick your tongue out. Up, down, and side to side. Very good. Alright, I'm going to be inspecting the neck here. Looking, your trachea looks midline. The jugular vein, looking for any distension, which I do not see on that side. That's good bilaterally. Then I would like you to tilt your head back, forward, side, side. I'm just going to palpate the trachea here. No difficulties, no tenderness there?
No.
Alright, I'm going to push it inside a little bit. Trying to palpate the thyroid gland, which I do not feel, so that is normal. Going for the carotid artery. And that's nice and strong. Next, I'm looking at the lymph nodes throughout the neck. And there's none felt. And then I will be testing the strength of your trapezius and then the sternomastoid. So I'm going to have you push back against my hand, forward, side, and side. Then I want you to push up. Alright. And then I'm going to be listening for the carotid bruits. Alright. I did not hear anything. Next I will be looking at the discrimination diagnosis. I'm going to place an object in your hand if you can tell me what that is.
Coin.
Very good. And then the graphesthesia, I'm going to have you give me your hand, and I'm going to trace a number in there if you can tell me what that is.
7.
Good job. And next one.
4.
Very good. We're going to complete range of motion of your shoulders, so I'm just going to have you rotate them. Alright, very good. Your elbows. Very good. And then your wrists, if you go up, down, side, oops. Very good. And then your fingers, you're able to move them, alright. And then rapidly. Very good. Alright. Then next I'm going to test the strength in your muscles in your deltoid and biceps. So I'm just going to feel your muscles here. Alright, and they seem to be uniform. So I'm going to have you go up, or I'm sorry, put your arms out like this and pull up towards you. Very good. And then down towards me. Thank you. And then for your wrists, I'm going to have you try to go up and down. Alright. And then your fingers, I'm just going to have you try to spread your, there you go, very good. Now next I'm going to be looking for, this hand too. And then I'm going to have you grab onto my hand. And strength seems to be uniform. Alright, then I'm going to be assessing the brachial pulse. That's good. And then the radial pulse. And that was noted bilaterally. Next, I'm going to be testing some reflexes. So we're going to do your bicep muscle first. So I'm just going to have you, there you go, just relax your arm. Very good. Very good. And then I'm going to, good. Sorry. Very good. And then the brachioradialis.
It's funny.
Then I'm going to do a sensation. So I would like you to close your eyes for me and tell me what you feel.
Soft. Sharp. Vibration. Vibration. Soft. Sharp.
Alright, then we'll be moving to the posterior chest. So I am looking for symmetry and the spinous process, which your spine does look to be in line. I'm palpating for any tenderness. Is there any pain or anything there?
No.
Alright. There are no bulges noted. And then I'm checking the thoracic expansion. Breathe out. Or I'm going to breathe in, breathe out, thank you. And then tactile firmitis, so I'm just going to place my hands on your back 3 different times. And when my hands are there, if you could just say 99.
99. 99. 99.
Thank you. Alright, and I'm going to across the outside wall here. I'm also checking for CVA tenderness. So there's no feel any discomfort with that?
No.
Alright, and then I'm osculating posteriorly and lateral. Take a deep breath. Again. 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 Very good. I'm going to do the same thing on the front side. I'm looking for respiratory movement and symmetry and any retractions. So I do not see any retractions noted. I'm looking for the maximum impulse, also known as the PMI. Okay, thoracic expansion. You can take a deep breath for me. Alright, and then same thing as the back, if you can say 99.
99,
Alright.
99.
Then I would conduct a breast exam. So I would advise you while performing a breast exam that you lie flat. Whatever side you are examining, you want to make sure that you have a pillow underneath that shoulder, and in a circular motion going from the nipple outward, making sure that you're feeling and covering all of the tissue. Standing in front of a mirror, straight up, looking for any dimpling and also any notations of discharge. Also going to be looking at the axillary lymph nodes. Put your arm up, thank you. And the other side. Sorry if that tickles. Alright, thank you. You can put your arm down. And then I'm going to percuss here. And that's good. I'm going to have you take a deep breath. Again. And again. Thank you. And getting the apical pulse here. Alright, and that was 64. And then I'm going to be listening to 5 positions here, starting with the apical and pulmonic. Tricuspid, Herb's point, and mitral. And I will repeat it using the bell of my stethoscope. So again, the apical, pulmonic, tricuspid, Herb's point, and mitral. Very good. Alright, I will have you lie down on your back. And I'm going to observe your abdomen. I'm looking at the contour, symmetry, making sure that there's no pulsations, and assessing your belly button. And the skin around that looks good. And I'll listen to all 4 quadrants. And there are vowel sounds present. They are within normal limits and not hyperactive. I'm listening for an aorta which I do not hear. And then I'm going to lightly percuss 1 to 2 centimeters. Oops, sorry, palpate. And then I will repeat that with deep palpation, assessing for any masses or abnormalities, which again I do not feel. And I'm going to percuss. Yeah, that's good. And moving down to the inguinal area, I'm going to palpate for her femoral pulse. I'm going to check that bilaterally. And then the inguinal lymph nodes, which consist of the horizontal and vertical chain, which I do not feel. And if I had a male patient, I would inform them on how to do a testicular exam. So for the lower extremities, I'm going to have you complete range of motion for your hip. So if I can have you lift your leg up and back down and up, yep. And then if you out to the side, back in, and then other leg. Very good. Then for you, I'm going to have you bend your leg up, oops, yeah, yeah, just like that, and then lift your leg down, and then out to the side, and across your body, and back, and then repeat with this leg. Up, down, across your body, and back out. Very good. And then for your ankles, I'm going to have you go down, up, out, in. Very good. And then if you just want to extend your toes, flex them. Very good. I'm going to test the strength of your hips, so I'm just going to move your arm out to the side. So I'm going to have you push out. Alright, with this one. Very good. And then have you lift your leg. Good. Good. And then for your ankles, if you want to pull them towards you and push against my hands. Very good. And then I'm going to have you roll onto your belly. And I'm going to ask that you lift your leg up. There you go. And another one. Very good. And while I have you rolled over, I'm going to assess your popliteal pulse. And that is felt bilaterally. Alright, so I will have you turn back over. And if you want to sit back up on the edge of the bed, I'm going to test your quad strength and your hamstring. So I'm going to place my hand here, my hand like this if you want to try to raise this. Very good. And then do the same on the other side. Very good. Alright, and we did your ankle strength. Then next, I'm looking at the tibial pulses, which I felt bilaterally, and then the pedal pulses. And I'm going to test sensation again. I'll have you close your eyes and tell me what you feel.
Sharp. Soft. Vibration.
Very good. And do it again. On the other side.
Vibration.
Very good.
Sharp. Soft.
Very good. Alright, so lastly, I will have you stand up. Sorry, I'm going to, before you stand, I'm going to look at your reflexes here. Alright, that are definitely present. That's the... There we go. And then your Achilles reflex here. Oh, that's alright. Now I'll just stand up. And then I'm going to have you, here, move out of your way here. I'm going to have you walk across the room. And then if you'll turn around and walk heel to toe. Alright, you can turn around. And then I'm going to have you bend over and try to touch your toes. Very good. Looking at her spine and the curvature of her back, which looks very good. And then I'm going to have you walk on your tiptoes. Okay, and then the heels of your feet. The insides of your feet. And then the outsides of your feet. And that is testing the muscle tone in your feet. And then I'm going to do the Romberg test and have you stand with one leg bent up, with your eyes closed, trying to balance. Very good. Very good. All right. And that concludes my assessment.